Chapter 5, the skeletal system, screencast 5. This is the last of the screencast for Chapter 5, and it's going to be focusing on two things. We're going to be focusing on joints or articulations and disorders of the skeletal system. So when we talk about joints, any connection between two bones is considered a joint. Now, it's just not those that we consider to be freely movable or synovial joints. So let's take a look at the different types of joints that we can find. We have fibrous joints. They are immovable, and the best examples of those are the joints between the flat bones of the skull. We have cartilaginous joints. These are slightly movable, and there's a cartilage connection. A really good example of those are the joints between adjacent vertebrae. Then we have synovial joints. This is what we typically think of when we hear of a joint. We think about our ankle, our shoulder, our hip. Now, these are bones that are actually separated by a fluid-filled cavity, and they're freely movable. So here we can actually see, basically this is an infant skull and these fontanelles. And what happens basically, these fontanelles fuse together, and we actually have sutures, and that's quite often what they're called. Now, synovial joints are made up of a joint capsule, and this is a synovial membrane with hyaline cartilage. Now, that synovial membrane, what it's doing is secreting synovial fluid, and that acts as a lubricant. Remember, a joint is an articulation between two bones, and this fluid is going to actually act as a lubricant. Hyaline cartilage actually, or articular cartilage, is a cushion. Now, when we look at types of synovial joints, there's more than these two. Hinge joint, the elbow is a really good example. The ball and socket, that's going to be the hip and the shoulder. Now, here's another term that we probably haven't introduced before, and tendons. This is another type of connective tissue, and they connect muscle to bone. Here, we're looking at the knee. So this is an anterior view of the knee with the patella reflected away. And many of you may have played sports and have heard of probably one of the most damaging injury, and that injury is a torn ACL or anterior cruciate ligament. And we can see that right here. Now, they can be surgically repaired, and athletes can come back from this. There was a time when they couldn't. And it was a very, very devastating career-ending surgery or injury in many situations. Okay, so here's the hyaline cartilage. Okay, we're going to see the meniscus. There's one on each side. All right, so we have a lateral and medial meniscus. Okay, we can see those ligaments overall. Okay, now here we're looking at a lot of the support at the knee is actually muscular. So here are the muscles of the thigh, okay, and playing a very important role. And we can see some of the other ligaments also. Now here, these are external to the capsule, okay, when we look at these two ligaments in particular. Okay, so just to kind of keep that in mind. But perfect example of a synovial joint, and that's freely movable, but at the same time, injured very frequently. Now, ligaments attach bone to bone in a synovial joint, and I use the anterior cruciate ligament or the ACL in the knee as an example. If we look at a tendon, that's attaching muscle to bone, and a really good example there is the Achilles tendon within the calf. Now, both tendons and ligaments are composed of tough connective tissue with very, very strong and flexible collagen fibers. And extra stability that we find at a joint is going to be muscular in nature. And definitely some joints are going to be more stable than others. If we look at the joints in the lower extremity, we're basically going to see the hip very stable. But if I look at the shoulder, that's very flexible, not stable, but keep in mind, mobility is very important in the upper extremity, and the job of the upper extremity is really all about hand positioning. If you had a lot of stability there, you wouldn't be able to position the hand as well as we can. Now, here we're looking at a number of movements. So we have abduction, so that's moving a limb away from a body's midline. Here's adduction. I think of add, where I'm actually bringing it back to my body. Here, extension, that's increasing the angle of a joint, whereas flexion is decreasing the joint angle. And here we have rotation and circumduction, so different movements that we see. Now, rotation is only seen at two joints primarily. We're looking at the shoulder and the hip overall. Now, the next few slides are focusing on diseases and disorders of the skeletal system. Now, sprains, this is specific to ligaments. Okay? You can stretch a ligament or tear a ligament. The problem here is once a ligament is stretched, you're going to have a decrease in stability at that joint. Now, I've sprained my ankle numerous times, and so I have very unstable ankles. Now, another thing that's important to know about sprains, they heal very slowly, and the reason here is there's not a lot of cells. Remember, we're talking about dense connective tissue with fibers closely packed together, so not a lot of cells, and on top of that, not very well vascularized. So ligaments don't have a really good blood supply. If I look at bursitis and tendinitis, bursa are these fluid-filled sacs. Okay, they can be inflamed, as can tendons. Okay, so bursitis and tendinitis. If we look at arthritis, there's actually two types here. We have osteoarthritis, and that's generally due to a wearing away of the articular cartilage. Rheumatoid arthritis, on the other hand, this is actually an autoimmune disease. So this is a much more severe case of arthritis overall. Osteoporosis, now we're looking at bone loss or decreases in bone density. Most commonly, we see osteoporosis in postmenopausal women when they become greatly at risk for the development of osteoporosis. Estrogen is a hormone that plays a very important role with regards to maintaining bone density in women. Now here we can take a look at a couple of things. So here is an electron micrograph of a normal bone, and osteoporosis in particular targets that spongy bone. And here, look at what we've got, a whole bunch of these areas that are weakened. These struts are not longer going to be able to support the stress that they can, so they will fracture very easily. Here we can actually see quite often a hump that's quite often familiar in people that have osteoporosis. And what I like in this particular slide is they're showing a male. Osteoporosis is not a disease that's limited to women. I actually have a lower than normal bone density, and that's due to the fact that during my growing years, I was a competitive cyclist. Cycling is not one of those activities that is going to load the skeleton. So during years where I should have been adding to my skeletal mass, I wasn't, because I wasn't really loading my skeleton as I should have with these high impact forces. So cycling does not do this. Swimming, we find running is good, but it's going to be really impact. Something like plyometrics really loads the skeleton.